Good, happy Thursday morning, September 9, 2021. I'm Riley King, and welcome to this Thursday morning edition of your morning news update right here on the Riley King Radio Network. I hope you all enjoy. Let's begin with your morning news update right now. First up, New Hampshire DHHS. Less than 20% of ICU beds are currently available. Let's take a listen to that video from WMUR News 9.
Here's today's hot and perfect tip.
Don't follow extreme routines. Do your own thing at Planet Fitness for just $1 down and get a real workout with tons of equipment and free fitness training. Join today for $1 down, $10 a month, cancel anytime. Hurry, deal ends September 16th.
We've seen more volume in our emergency departments than we've ever seen.
Across the Granite State, emergency rooms are packed, and workers tell us it's not just because of an influx of patients with the Delta variant.
We're also seeing a lot of patients who have delayed their care because of COVID, and because they've delayed their care, maybe a little sicker than they expected to be.
Wentworth Douglas Hospital currently has more people in its emergency room than its staff can handle. Their director of emergency nursing tells us they're having trouble keeping up because staffing levels continue to go down.
They are leaving healthcare altogether. They're exhausted. They are exhausted from the numbers of people that they're treating. They're exhausted emotionally. They're exhausted mentally and physically.
They need our help. And that means, that we as individuals, as communities, need to do everything we can to prevent this surge from growing.
It's a similar trend elsewhere across the state, with doctors and nurses begging the public to continue masking, distancing, getting vaccinated if they can, and avoiding trips to the ER unless absolutely necessary.
Use the emergency department when it's an emergency.
The reality is the people that we're seeing in the hospital are predominantly those who have not been vaccinated.
And Wentworth Douglas tells us tonight they have 20 patients with COVID-19 in their emergency room. 18 of those patients are not vaccinated. Reporting live tonight, Scott Koch, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire hospitals stressed as COVID-19 hospitalization increase. Let's take a listen to that video from WMUR News 9.
Here's today's hot and perfect tip.
Don't follow extreme routines. Do your own thing at Planet Fitness for just $1 down and get a real workout with tons of equipment and free fitness training. Join today for $1 down, $10 a month, cancel anytime. Hurry, deal ends September 16th.
This graph tracks the arc of hospitalizations in New Hampshire starting in April 2020. The sharp bend upward started in October 2020 and peaked 3 months later in January. The increase this time started in July and 2 months later is still rising.
I think that it is extraordinarily similar. The difference this time is that we haven't shut down any elective services. So our hospitals are running at 100% capacity, yet we're seeing this influx of COVID-positive patients.
Tom Mee of North Country Healthcare says the challenge in that part of the state is finding tertiary hospitals with room to accept their sickest patients. Hospitals everywhere are filling up again.
No question, hospital capacity is tight. It has been and will continue to be as we navigate through this current surge of COVID-19 patients.
The refrain is the same. Get vaccinated, socially distance, wash your hands, and wear a mask. Health officials say they are as tired of all of this as the rest of us. But there is a way out, but they need the community's help.
What we know is that the vaccine is absolutely the most effective way. We don't know that anybody would have thought that things like a vaccine or a mask or other things like that would become such, potent political, wedge issues.
Flu season is approaching. Steve Anand says last year the flu was nearly non-existent here in the state of New Hampshire, and that's unheard of. Anand says that's because people were masked, vaccinated, and socially distanced. We're live in Manchester. Amy Cavino, WMUR News.
Okay, and there you go on that video and that report. Some New Hampshire schools turned to masks in response of COVID-19 cases. Let's take a listen to that video from WMUR News 9.
Walmart, America's largest, is hiring. Earn up to $25.50 per hour plus benefits working at Walmart's distribution center. Get a $5,000 sign-on bonus. But hurry, you must be hired before September 24th. Apply today online or text DC to 240240. Walk-ins welcome.
All schools are back in person, some more than a week now. COVID-19 an ongoing reality.
So we expect some amount of cases that will happen, and that has happened, but not in any type of a spike, proportion.
Each district with its own chosen mitigation measures. Epping returned last Monday with a mask mandate.
We've had one student positive case during the first week of school.
No masks or physical distancing in Bedford. 2 clusters at one elementary school. Those classrooms now masking. 11 cases at another.
At Memorial Elementary, which is our smallest elementary school, we actually had 3 clusters, and so we went into something we call targeted masking. So that whole school is masked up until the 17th.
While there's no proven correlation yet, the superintendent noting the difference between this year and last.
Last year we had physical distancing, we had masking, and we didn't have Delta. And so we didn't have transmission. So this year we have transmission. So we're going to have to look closely at this to see if we need to start employing more measures.
The Hillsborough Deering District returning to masks tomorrow. The superintendent telling parents, we have seen an increase in COVID cases develop across the school community. Our number one priority is to safely maintain in-person learning in all schools. And we are already seeing an impact to our staff capacity to operate safely. Mask mandates have been hotly debated in many districts, and that debate may not be over. Jennifer Crompton, WMUR News.
Okay, and there you go on that video and that report. One more Granite Stater dies as COVID-19 cases fall for the first time this month. Let's take a listen to that video from WMUR News 9.
Lost River Gorge in Boulder Caves is one of New Hampshire's greatest natural wonders, and
Turning to COVID-19 tonight, there is one new death to report, and active cases are down in New Hampshire, dropping by more than 300 since yesterday. But hospitalizations continue to creep up to their highest point since February. And right now, 142 people are hospitalized in New Hampshire with COVID-19.
Okay, and there you go on that video and that report. Sununu says doctors urge him to minimize stress after medical scare. Let's take a listen to that video from WMUR News 9.
Walmart, America's largest, is hiring. Earn up to $25.50 per hour plus benefits working at Walmart's distribution center. Get a $5,000 sign-on bonus. But hurry, you must be hired before September 24th. Apply today online or text DC to 240240. Walk-ins welcome.
From his earliest days in office, Governor Sununu has been on the move, and he's been front and center amid the pandemic as the state's chief executive. But the long hours and stress caught up with him last week when he ended up in the hospital with extreme exhaustion and dizziness from a bleeding ulcer.
They had taken some blood, and they were just wonderful staff, and the nurse kind of pops into the room a little bit wide-eyed, grabs the doctor, and she starts saying some number, 5.2 or 5.3 or something. I don't know what it means. And the doctor quickly turns around and starts asking me a lot more questions about what has happened over the past few days. And I couldn't figure out what was going on. And he said, look, you've lost a lot of blood, a lot of blood.
Sununu says the relief of having tested negative for COVID earlier in the week was long gone at that point.
It was like, okay, I'm in the right place. There's something wrong. And they said we have to start transfusions immediately. And so that's kind of a scary point. I knew right then it was much more serious than anything I had anticipated.
A blood donor himself, the governor received a series of transfusions thanks to the donations of 3 to 5 other people.
In that moment, you think, boy, I paid this one forward, thank goodness, and I got to keep paying it forward.
Sununu says he's on the mend, but it's going to take time for him to recover.
My blood levels won't be back up for probably another month or so.
Sununu says he'll still be giving 100% as governor, but doctors have told him he needs to find ways to de-stress.
He said, I'm not going to tell you anything you don't already know, right? eat healthier, try to exercise a little more, try to minimize your stress, take more time for yourself. I mean, all these things that we hear about all the time, but we think we'll get to it down the road. I just probably have to prioritize that a little sooner, and you know, rightly so.
In Newfields, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. And that does it for this morning news update right here on the Riley King Radio Network. Thank you for tuning in and listening to this morning news update. I hope you all have a great rest of your day, and I'll see you back here later on today for another news update. Goodbye, everyone.